Welcome to the Myrna Method live stream. I'm registered dietitian Myrna Haag. I try to bring you nutrition science, decoding some of the science out there to help you know what foods, how to eat. That's number one, going to create a dietary balance, stabilize your metabolism, and bring you sustainable health. So Sam, if we can get started, I was at a convention, Physicians Committee for Responsible Medicine, and I wanted to bring to you the takeaways. I thought it was awesome, learned a lot, and these are physicians from all over the country that are bringing you nutrition science at its best. So what this video is going to do is I'm going to go through some of the key highlights that I think are super important. And then I'm going to do some of the summary in regards to nutrition, some of the things maybe I wish they would have covered a little more. So let's start out with looking at the speakers. And I always think, I want an array of speakers that have vast experience. I want them practicing. I want them at hospitals. So I don't just want people that are interested in nutrition or, I want people that are right now in the field working, serving positions in medical staff. And that's clearly what we had at this convention. I think the key takeaway is that a plant-based diet is the number one diet for preventing and reversing most lifestyle diseases: diabetes, autoimmune, heart disease, cancers, and Alzheimer's. Now remember, I'm giving you the takeaways from the convention. So that's what the video is going to be about in these slides. So what's plant-based, typically referred to as vegan? It includes no animal foods. And they also advocated low fat. So this was a plant-based, low-fat dietary program that they were recommending in regards to being one of the number one disease preventions. So what are some of the magic components that make plant diets healthy? Well, what plants have that animals don't is phytochemicals. Those are the chemicals that come from the sun, right? Phytochemicals, fiber, and fiber is in itself got so many properties. Fiber in the fermentation process can create even more chemicals, bacteria that I've talked about in my podcast that can travel to other parts of the body, other areas of the bodies, have receptor cells for these specific bacteria and these short chain fatty acids, these chemicals that only come from fiber. So when you look at some of these fiber compounds, they're specific to fiber. These bacteria, I should say, that are made from the fiber foods. Also, the gut bacteria fermenting enzymes, and that's somewhat what I'm referring to. The fat quality, they talked a little bit about that. Saturated versus unsaturated fats, why that's important for some of these metabolic diseases. The alkaline load versus the acidic load. So I'm not going to get a lot into the alkalinity versus acidity, but it does refer, and I know with my practice, when you do eat a lot of animal foods, and by the way, I'm not talking about a balanced amount, I'm talking about excessive, you can have a lot of uric acid. It's an inflammatory problem that you can get. It can also increase arachidonic acid. You can increase more of these omega-6, which can also lead to more inflammation. And also, they talked about specific micronutrients that are in plants specifically for detox. Now, animal foods do have a lot of vitamins and minerals in them, specifically, maybe not as rich in plants, but specifically, they're referring to certain nutrients that are instrumental in the detox process in our body. And that's going to be antioxidants. I think most people, when they think of detox and plant-based. So they listed in order, which were the ones with the most driving disease prevention properties. Which ones are we going to put at the top of the list, and which ones do we put at the lower end? And the ones that made the top of the list were the phytochemicals, the antioxidants. That's when I was referring to those detox nutrients that were a little different in plants and animals, polyphenols or carotenoids. These are all found in plant foods, part of those, phytonutrients, all coming from the sun. And then also interesting, I thought dietary fiber was really talked about a lot in regards to the gut health, cholesterol, how it can lower cholesterols, and also insulin, the relationship between fiber and helping to stabilize the blood sugar. The micronutrient density, again, the vitamin C's, the magnesiums, the potassiums, these are things more specific and higher quantities we're going to see in the plant foods. Also, complex carbohydrate, resistant starches. This is where I get a lot of flack. A lot of people are like, oh, I don't need to eat carbs. Well, carbs play a specific role. I'm not going to get heavy into it in this live stream, but carbs are an important macronutrient. There's 4 macronutrients: protein, fiber, carbs, and fat. Everything you put in your body has those 4 macros. And a lot of what I work with my patients and teach people in my program is understanding how those macronutrients are significant in our life, in really even changing our health trajectory, period, and how people don't really understand how they work. They didn't really talk a lot about the macros, but they really got into the health part of the foods, the plant-based foods, which I think is still amazing and fascinating, which I want to share with you. But at the end of this video, I'm also going to bring in the macronutrients, because I think it's so important that all these phytochemicals in this fiber, the macronutrient density, all of this is super amazing and important. We're going to go through some of the studies, but also important is understanding, as you're eating this healthy plant-based diet, you still have to look at the amount of proteins, the amount of carbs, the fat, and the fiber, the amounts. So I want to go through and talk a little bit about some of the speakers. I'm not going to be able to go through all the lists, some of the highlights, but I wanted to shed light on how these physicians are practicing physicians. Dr. Williams, he's in preventive cardiology. He advocates a plant-based diet for prevention of heart disease and disease-related risks such as hypertension and diabetes. A lot of talk on diabetes, the literally reversal of type 2 diabetes with a low-fat plant-based diet. And I know a lot of people are rolling their eyes thinking, wow, that's not what I've been told. But again, like I do in most of my podcasts, I'm going to bring you the science on that, because I really want you guys, number one, to hear what some of the top physicians in the country are stating. And then number two, I want to show you the biochemistry on that, so you can really know the whole scope. After all, this is your health, your body, super important. You get the truth and you understand the science behind it. Dr. Williams is the chair of medicine at the University of Louisville. He specializes in general cardiology, preventive cardiology, and cardiovascular radiology. He is a past president of the American College of Cardiology and the American Society of Nuclear Cardiology, and a former chairman of the board of the Association of Black Cardiologists. He is chief cardiologist at Wayne State University. He's written several papers. Some of the things that were talked about, not just from Dr. Williams, but with several of the other speakers, is clarifying how a whole food plant-based diet lowers cardiovascular disease risk, and a lot of these refined carbs do not. So really making that distinction between, even if you're vegan, you got to make sure, just because it's no animal, that you're getting the right combination of plants, right? We're not just doing no animal, but we're really bringing in the word plant-based part of this into the program. After all, it's the plants that have all these special chemicals that have these healing properties. He's also written several papers on the evidence of plant-based diets and the prevention and treatment of cardiovascular risk factors, specifically stroke, hypertension, diabetes, heart attacks, overall mortality. He also discussed, and a few others did, some of the real-world barriers in adopting a plant-based nutrition lifestyle, which I'm going to talk a little bit as well at the end of the video when I kind of bring it all home. So one of the studies by Dr. Williams estimates that the global shift to plant-based diets could prevent up to 11 million deaths annually, accounting for approximately 20% of the adult deaths per year. And what they're really advocating is a strict low-fat, whole food-based diet, not just low animal and junk food, right? It's been shown to lower serum cholesterol as much as 150, down to 150 reading, okay? So if you have a cholesterol above 200, that's considered a risk factor. So this can significantly lower the cholesterol, which they have talked about in studies. It stabilizes the severe risk of cardiovascular disease and cardiovascular events. So I think it's important to know that there weren't just a few physicians, but most of them were advocating the same type, talking about the same type of research. I'm going to bring Dr. Dean Ornish into the picture. He was a speaker. He's founder and president of the nonprofit Preventive Medicine Research Institute. He's a clinical professor of medicine at UCSF. And honestly, Dr. Ornish has probably got the most clinical evidence. For over 44 years, Dr. Ornish has directed randomized trials demonstrating for the first time that comprehensive lifestyle changes may begin to reverse even the most severe coronary heart disease without drugs or surgery. So in other research he's done, he's shown that a comprehensive lifestyle changes affect gene expression, turning on disease-preventing genes, and turning off genes that promote cancer and heart disease. And I think the biggest push in this conference was a lot about cancer and heart disease. That was and diabetes. That I think some of the biggest focus in most of these lectures. Now remember, it was a 3-day convention, so I'm not, obviously 8 hours a day, not going to be able to tell you everything, just kind of bringing the highlights and the takeaway. Dr. Greger was there. He was a speaker. He's a funder and member of the Fellow of American College of Lifestyle Medicine. He's a physician, internationally recognized speaker on nutrition. He has a really good nonprofit, nutritionfacts.org. You can get a lot of studies that he posts there. I'm going to take you into one particular study that you might want to watch the video, because I think it really gives you in about 5 or 6 minutes more science on diabetes and insulin resistance, which I'm going to also do in this video. But it's good to get it from different clinicians because you get it sort of told to you a different way. Same idea, same science. Dr. Bernard, he's president of the Physicians Committee for Responsible Medicine, professor of medicine at the George Washington University School of Medicine in Washington, D.C. He has led numerous research studies investigating the effects of diet on diabetes, body weight, chronic pain, including a groundbreaking study of dietary interventions in type 2 diabetes patients funded by the National Institute of Health. And with Dr. Bernard, he did research even 20 years ago stating that diabetes can be reversed if we are watching our fats. And this is really so counter intuitive to what people believe, because everybody's chiming in on diabetes being about lowering the sugar in the blood, although that's a major factor. The root cause of the disease is from too much fats, which is why they're advocating a low-fat diet for diabetes. Don't worry, because in about 5 minutes, I'm going to walk you through the science on this. I just wanted to have you see what some other physicians from all over the country are stating in regards to some of the top metabolic diseases that are killing us: type 2 diabetes, heart disease, Alzheimer's, cancer, obesity. These are the big ones. Dr. Greger and I'm going to put this up on the screen. If you're listening to me, maybe you want to go back and find this slide. It's nutritionfacts.org. And when you click into nutritionfacts.org, one particular video I think would be really helpful. It's a video called "What Causes Insulin Resistance?" And in this video, they're going to explain to you how excess fatty acids are the root cause of insulin resistance and type 2 diabetes. And obviously, in this convention, they really pushed a lot of science that showed that a low-fat, plant-based diet can reverse insulin resistance even after 16 weeks. And I'm going to say plant-based because a lot of these plants, going back to the slide, not that you couldn't go back to the slide, but I just want to keep putting it in your brain so that you can remember some of the magic components of the plants are these phytochemicals made from the sun when they shine on the little leaves or the plants. They produce special chemicals that you don't get in other foods. It's only plant foods that have fiber. And these fiber create these gut bacteria, and these enzymes from these bacteria do a lot of health promoting function in the body. Also the alkaline versus acidity, and also just specific nutrients that can actually detox the body. So the idea is you have these plants with all these healing properties that can actually improve the health of our body. And then they bring in the low fat to show that a lot of these, and this is where we're going to get into the macronutrients. Remember, protein, fiber, carbs, and fat. Now you're walking into my playground. But they do talk about how excessive amount of fats, and a lot of people are doing it. You know, I know avocados and I know nuts are healthy fats. So we know that there's something to be said about the fat quality. But you also have to look at the fat quantity. And this is a lot of my takeaway in many of my podcasts, because I really try to drive home the importance of getting the macronutrients. A dietary balanced diet, protein, fiber, carbs, and fat. Why is it important that we want to maintain the right amount of these macros for the day and also at meals? I'm not going to talk about that in this video, but I want to shed light on the fact that plants are really wonderful. But we also have to look at the science in nutrition on how those plants fit into how much protein you need, fat you need, carbs, and fiber. Let me explain to you what's up with insulin resistance. Let me give you the biochemistry. And you're going to also see this if you click into Dr. Greger's video. He says it a little different way, but I'm going to show it to you. Same science in a different way. So every time you eat a carbohydrate, it breaks down into the bloodstream as glucose. The goal of glucose is to get inside muscle tissue, and there's also certain neuronal cells in the brain that also really want the glucose. Now, can your muscle or brain live without it? Well, just so you know, the liver, our good old friend the liver, does dump some glucose in the blood. Thank you for that. And yes, muscles can feed off of fat for fuel. But there's a purpose why your body wants you to have carbohydrates. Carbo meaning fuel, hydrate meaning water. Is carbohydrates, when they're stored in muscle as glycogen, actually hydrate cells. That's why they're called carbohydrates. For every gram of sugar, you're going to get 3 grams of water attached to that when it's finally stored in the muscle. So let's talk about glucose being stored in the muscle. The main purpose of carbohydrates, of glucose, is to try to get to the muscle to be stored and to serve as a fuel source. Muscles want to have carbs. Yes, they can do without them, but doing without them and actually wanting them are 2 different things. Bottom line, the only way glucose is getting inside that muscle is through the hormone insulin. Every time you eat a carbohydrate, it breaks down to glucose, which releases the hormone insulin. Insulin then attaches to a receptor site that sits on the muscle cell, receptor sites that also sit on certain neuronal cells in the brain. And the purpose is, when insulin sits on that insulin receptor site, it talks to a messenger who talks to another messenger and allows the transporter to the surface of the cell. And that allows the sugar in the cell. The only way the sugar is getting in the cell is when insulin tells the cell to make it happen. But here's what happens with insulin resistant, is that insulin receptor site becomes disabled. That insulin receptor site is not able to tell the cell to bring the transporter to the surface. That insulin receptor site is all clogged up with excess fats. Where are these excess fats coming from? Number 1, too much body fat. So when you have an excessive amount of body fat, it begins to release fatty acids into circulation, which then accumulate in muscle cells, or maybe you eat too much dietary fat. So here we go. This can happen. You could be at your ideal body weight, but just eating a lot of those nuts and avocados, I'm not saying it's a better quality of fat. And there's some studies that absolutely show you're better off eating some plant-based fats, oils, perhaps. But there's a lot of studies that show, especially lately with these seed oils, can actually trigger more inflammation than help you. What happens is a lot of these excess fats begin to accumulate in muscle cells, and they differentiate, they change to a type of fat called a ceramide. Now, I was really surprised because they didn't even mention ceramides in the conference, which I thought that they might have had something on them. But ceramides are just a type of fat that the body chemically changes, and it's actually these kind of fats that are very disruptive to this insulin receptor. But bottom line, ceramide or not, it's coming from excess fatty acids, from either being too fat or eating too much fat, or maybe both. Now, if you lose a lot of weight, the good news is you're going to lose a lot of body fat. And this will absolutely reduce some of the insulin receptor site clogging because you're going to have less fatty acids in circulation. Which is why any type of weight loss we're going to see, I don't care if you're doing weight loss on a carnivore diet, you lose a lot of body fat, we're going to see instant positive results on your blood level. But it doesn't mean that it's going to be sustainable. In other words, you may be just kicking the can down the road because biochemically, these receptor sites with too much fat, remember, protein, fiber, carbs, and fat, we need to understand how much we need of these. And specifically, in this conference, they talked about a lot of high-fat diets being very disruptive for type 2 diabetes and actually being the root cause of the disease. So remember, 30 speakers at a conference, latest research, working in hospitals all over the country, basically stating what I'm showing you here. So what is the takeaway is that excess fatty acids in circulation is what's called lipid toxicity, and I've referred to this before, and this starts a lot of the metabolic diseases. So, obviously larger fat cells are because you're gaining too much fat. This can also recruit immune cells, it recruits more fatty acids, and this disables the insulin receptor site. And when that insulin receptor site is disabled, welcome to insulin resistance, because it means that the muscle is not open up, it's resistant to insulin's message to allow sugar in. Insulin resistant means that, okay, maybe only 20 to 30% of the muscles are disabled. Once you start getting to 40 or 50 of the insulin receptor sites becoming disabled, then we're pre-diabetic, keep going, and you have type 2 diabetes. I want to make a special note here. I feel it's worth mentioning. Obviously, if you do a low-carb diet and you decide to, take out the carbs from your diet, a couple things will happen. You take out the carbs from your diet. Instantly, you're going to lose a lot of water weight, because remember, for every gram of a carb, you've got 3 grams of a water. So you're going to dump a lot of water weight, because when you reduce the carbs, you reduce the hydration. You're also going to reduce the insulin. And when you reduce the insulin from the blood, that can be a positive thing, because when you have a lot of insulin in the blood, it can make you hungry. A lot of insulin in the blood can make you tired. So the big push is, let's take out the sugar from the blood, let's reduce the insulin, and long and behold, your A1C, which measures the sugar in the blood, begins to drop. Everybody's so happy, applauding, wow, isn't this wonderful, isn't this great? The problem is, all you did was reverse the symptom. The root cause of the disease is sitting in the insulin receptor site. So you're going to do pretty good for a couple of years. And then it's going to start to surface, because you're going to clog more and more of these receptor sites. And then it's not even going to take that much, and you're going to start to see an elevation of glucose in the blood. One thing I want to mention as well with insulin resistance, it's so tough. It's so tough to get to your ideal body weight, because when you have insulin resistance, and you just eat a lot of carbs, because nobody explained to you you have to balance them, which is my whole take in nutrition. And you eat a lot of these carbs, you increase a lot of the insulin. When the carbs can't get inside the muscle because that receptor site's clogged because you're eating too much fat or you're just too fat, the sugar is going to start to go to the fat cells. And that's exactly what happens. Maybe you didn't even eat more calories, but you just notice it's harder and harder to lose weight. And God knows the belly's getting bigger and bigger. That's because the glucose that didn't make it into the muscle goes into fat cells, specifically in the midsection, belly fat. This is insulin resistance. It's a main culprit for a lot of metabolic diseases. It starts it all off. It also is a big culprit for type 3 diabetes, because when it happens in the muscle, it's happening in the brain. Type 3 diabetes is Alzheimer's. So insulin resistance of the brain is cognitive decline. What I want to really make sure that you understand is over 30 speakers bringing research, the best of the best, and not one person denied this was the root cause of type 2 diabetes. In fact, they all stated, get all the healing properties from the plants, and for God's sakes, don't eat a lot of fat. That, to me, was a big takeaway. So what I want to talk about next is cancer. There was a lot of good speakers on cancer, and what I really felt was worth it for you is I'm going to read you an excerpt from Dr. Funk's book on breast cancer. But most of these doctors are doing leading research in cancer, and they're all from different sources. Dr. Edward Giovanacci, I probably didn't say that right, so I still apologize. He's a professor of nutrition and epidemiology at Harvard T.H. Chan School of Public Health. He's currently an American Cancer Society clinical researcher, professor. His research focuses on how nutritional, lifestyle, and genetic factors affect the risk of development and progression of cancers and other major chronic diseases. He serves as a member of the expert panel for the World Cancer Research Fund, American Institute of Cancer Research, and on the United States 2025 Dietary Guidelines Advisory Committee. Just a little adjunct here. I was really a little bit disturbed and concerned how a lot of these researchers did bring to the Dietary Advisory Council a lot of the research, and a lot of it just didn't make it into our dietary guidelines. I'm just going to throw that out there. Also, Dr. Shan is an assistant attendant at Sloan Kettering Cancer Center. She is board certified in internal medicine. Also, Dr. Fung, who is board certified breast cancer surgeon and physician. She has helped thousands of women through breast cancer treatment. Her extensive nutritional science research caused her to expand the passion for her medical practice. She teaches women and men how to maximally reduce their chances of facing cancer or any other controllable killer diseases. And I really felt it was worth talking about. I want to just read to you one insert from her book because I felt it was really important. So many times patients come to me and they're really freaked out about eating soy. And they're convinced and they've been told that soy is a major problem. So I wanted to read to you, it's about a page and a half. Think of it as an oral book right now because I'm going to kind of go there with you. But I really think it's worth you knowing this. Otherwise, I wouldn't do it. So I'm going to start, and the chapter this is by Dr. Funk. There's something special about soy. No, really. It's time to set the record straight on this healing ingredient because it gets an unfair bad rap. Soy contains isoflavones, some of which act as phytoestrogens, parentheses, plant-based estrogen-like compounds, parentheses. And estrogen fuels most breast cancers. So I'll bet somebody somewhere told you, say no to soy. And you spit that miso soup right out of your mouth. Most physicians believe this to be uncharted territory, so they err on the side of caution and advise you to avoid all phytoestrogens. I guess they haven't seen the evidence, so let me show you. First of all, we have two totally different estrogen receptors in our bodies. Estrogen receptor alpha and estrogen receptor beta. When estrogen from any source stimulates these receptors, the cells respond according to their programmed active form, making this superfood even more super. Tofu, soybeans, edamame, roasted soybeans, and soy milk are great ready-to-consume options. Although, she states, avoid soy milk made from soy protein or soy isolate. You want to see whole, organic soybeans written as the first ingredient on your milk label. Processed soy products lose some of their nutritional value that are found in whole foods, but they can still provide great substitutes for meat, sausage, cheese, eggs, yogurt, and milk. So basically what she's saying is she's trying to show the science behind the actual soy in the plant itself. She goes on to say, in the breast cancer estrogen receptor alpha, it sends signals to cancer cells to multiply and divide. So the estrogen receptor alpha, that's the one responsible for that cancer multiplying effect. Whereas the estrogen receptor beta actually exerts an anti-estrogen effect. So once again, I want to remind you, you get two receptor sites. Estrogen receptor alpha, which it seems what she's saying here is the one that really turns on the estrogen in the body, multiplies the cancer. And then now she's talking about the estrogen receptor beta, two receptor sites. And this one is considered the anti-estrogen receptor. And she goes on to state, it turns our natural estrogen receptor alpha, yes, the ones implicated in cancer, these are the ones that she's referring to turn on the cancer. But then she says, when the soy phytoestrogens like genistein, they can bind 1,600% more to the alpha beta than alpha. So, I'm sorry, to the estrogen receptor beta than the estrogen receptor alpha. When bound to the estrogen receptor beta, which what she's saying is when these phytoestrogens from plant attach to the estrogen receptor beta, soy actually blocks estrogen from sitting on the alpha chair. So if I had to explain it to you in something that can hopefully visually make more sense, because a lot of this sciencey stuff can be sciencey, you have two receptor sites. When these plant-based soy phytoestrogens bind to the beta, they're not going to bind to the alpha, they're going to bind to the beta, two receptor sites. They're going to bind to the beta. And when they bind to the beta, they inactivate the alpha receptor's ability to bind to the estrogens in the body that produce the cancer. And she goes on to say, when bound to its estrogen beta throne, soy actually blocks estrogen, here's what she's saying, from sitting on the alpha chair. And if soy should land in the alpha receptor, it has about a 1/10 to 1/100th of the signaling capacity of real estrogen. So soy essentially behaves like tamoxifen, a drug given to cancer patients. It occupies and inactivates the estrogen alpha receptors. On top of that, soy stops the conversion of other steroids into estrogen. Okay, that's true. Then, she says, if that's true, then people who consume soy should drop their circulating estrogen, right? And she says, right. A group of menopausal women in Texas drank 3 12-ounce cups of soy milk a day for 1 month, depending on where they were in their menstrual cycles. Premenopausal women, sorry about that, not menopausal, a group of premenopausal women. Depending on where they were in their menstrual cycles, blood levels of estrogen dropped between 30 to 80% in all of them. And estrogen levels stayed lower than baseline for another 2 to 3 months. Wow, soy really does slow estrogen production. With less estrogen from a few daily servings of soy, we should then expect to see less breast cancer forming. She says, yes. One study examines the dietary intake of over 73,000 Chinese women and concluded that consuming soy during childhood, adolescence, and adult life protected against breast cancer, especially when they consumed it at youth. Early soy intake more than 1.5 times per week, which isn't really much, during childhood reduced adult onset breast cancer by 58% in a study of Asian women in California and Hawaii. So, she states, tell your daughters to soy it up. Even among Korean and BRCA gene mutation carriers, largely considered to be at the mercy of their DNA breaks, a reduction in breast cancer up to 43% was noted on high soy consumption. Okay, so far, soy blocks estrogen, affects the estrogen receptor alpha, it lowers estrogen levels in the blood, it protects against making breast cancer. But what if you already had estrogen-driven cancer and you're on a drug that blocks estrogen actions in your body, like tamoxifen? Well, the isoflavones in soy interfere with these drugs? Well, until 2009, she states, we weren't sure. In the Life After Cancer epidemiology study, 1,954 multi-ethnic survivors on tamoxifen, which is the estrogen-driven cancer drug, were followed over 6 years. Those eating the most tofu and soy milk products had 60% reduction in breast cancer reoccurrence compared to women ingesting low soy amounts. The isoflavones not only deal favorably with estrogen, they exhibit also other antioxidant properties, anti-angiogenesis, anti-inflammatory. So bottom line, soy even kept the estrogen-negative tumors at bay. The largest soy study to date in breast cancer patients followed over 6,200 multi-ethnic women from the United States in cancer for 9.4 years for those consuming nearly a half to one serving of soy a week. Researchers observed a 21% decrease in all-cause mortality compared to the lower soy consumption. This increased to 51% for estrogen-negative cancers and 32% for those estrogen-positive cancer patients not taking therapy. Another study with over 5,000 breast cancer patients found 29% decrease in death and 32% drop in reoccurrence for high soy consumers, independent of receptor status. Even just 1 cup of soy milk a day provides enough phytoestrogens to reduce the occurrence by 25%. So soy consumption after breast cancer is not only safe, but it's protective. And I thought that was really, important because there's so much controversy regarding soy. And I'm glad to see now that we have more studies that back this up and kind of clarify that. So in summary, what the research reflects, what some of the takeaways were from this conference is to eat less fat. So you walked away knowing that that was important. Plants have healing properties. Lot on all the different types of foods that are from plants and how these different compounds in plants do serve as healers for the body. And then they talked about the fiber from the plants and how this creates this gut microbiome. And also they talked about some animal foods that actually can create some harmful bacteria to the gut as well. And I know I've talked about that in some of my podcasts. Now, you're always going to have that balance of good to bad bacteria in the gut. So even if you eat a small amount of plant, a small amount of animal, you still have to eat a certain excessive amount to produce some of these bacteria. I just kind of want to state that, okay? Because I don't want somebody to think, oh my God, I ate like an ounce of chicken and now I'm going to get this bad bacteria. No, it's really going to talk about balance. They didn't really discuss it in this convention. I'm going to discuss it in about 5 minutes. But clearly, plant foods are at the top of the list for creating this healthy gut. One of the things they didn't talk about is that you can't go from 0 to 60. You can't be on a Western diet or start on a carnivore diet and then all of a sudden you're going to bring all these plants into your diet and think things will turn out well. They probably won't, because you have to develop your gut to be able to tolerate a lot of these plants. I'll talk about that a little bit later. So animal foods create inflammation, and they're the main culprit for current disease conditions. Once again, I'm highlighting what was really discussed in the conference, some of the studies, and what the takeaways were. They also talked about maintaining an ideal body fat. We talked about body composition. They talked about low-fat, plant-based diets, providing nutrient-dense, calorie-low food volume, and they talked about all of it in the sense of nutrition and how to eat the foods. They talked about fat tissue in men actually steal testosterone. So the fatter the guy, the more their fat cells steal the testosterone. And what happens in the fat cells is that there's an enzyme that changes that testosterone to estrogen. So no, men boobs are more related to getting fatter than eating soy. And the fat tissue in women actually increase estrogen dominance, once again, because those fat cells, estrogen is stored there, and that can also increase the risk for cancer. So ideally, we want to try to maintain our ideal body weight. So let me talk about some things I felt I want to bring into the equation. Being a registered dietitian, totally agree with all the wonderful attributes plants bring, but I really want to shed some light on macronutrient values. Understanding you need to know your numbers. How much protein do you need for the day? And we will talk about some of the protein they were recommending, and then I'm going to walk through to you some of the numbers, because they really didn't get into specifically how much protein should you have, how much fiber, fat. It was a low-fat diet, but it's like your bank account. I always say, you can't just irresponsibly spend money and not know how much money's in your bank account. Well, the same with your macros. You can't irresponsibly be just consuming foods and not understand what is in your nutritional bank account. And that's how I look at these macronutrients: protein, fiber, carbs, and fat. And also these macronutrients play not only a huge role in our daily values, which I'm going to really just kind of talk about in this video, but also in balancing meals. They create a homeostasis. They regulate some of our hormones for our metabolism. Not going into that with this video, but the highlight is get your macros right on a plant-based diet, and then we're talking, okay? To ignore the macros, not such a good idea. And also fiber adjustments. You can't eat all these plant foods if your gut isn't tolerable. So I always have to start my patients on fiber foods that are tolerable. Knowing that the actual fiber foods, and this is kind of like an oxymoron, it really is, because the actual fiber that has all these great bacteria, because that's how you break down fiber foods. It's actually the bacteria in the food that helps you do that. But it's kind of like you have to get able to tolerate the foods that have the bacteria to break down the foods. So that's why if you're not used to a high plant-based diet and you suddenly start on one, well, you can have a lot of bloating, a lot of discomfort. I always tell my patients you can't go from 0 to 60 in a month. It could take you a whole year to really slowly bring in some of these plants to where they are tolerable. And I really want to talk about two main macronutrients that I think are super important. Maintaining adequate protein. And I think a lot of times on a plant-based diet, I know with a lot of my patients, they really don't understand the two main things that can totally negate all the benefit of the plants, all the phytochemicals and all the wonderful healing properties of the plants. If you're not really looking at the amount of protein you're getting on a plant-based diet, and also truly knowing the fat. How much fat are you really eating? Because a lot of people tell me, I'm on a low-fat diet. I'm like, really? Because it's not what I'm seeing. Because they don't even understand foods that have fat. They just figure if it's vegan, it's got to be good for me. So let's talk right now. Let's really get into how much macronutrients do you need. I did some easy formulas for you. So you take your current weight for protein. And protein is really anywhere from, let's say, 18 to 25%. Now, with a lot of vegans, their protein can be as low as 12%. And we'll explain where some of that science comes from. Excessive amount of protein isn't that good for you, especially if it's animal. But honestly, if you're getting excess protein from plants, I'm totally not as worried about it because you're not going to get those high uric acids like you are from animal. But the problem is if you don't get enough protein, that's not going to be a good thing. So let's go over the amount you need, and then I'll show you some of the repercussions of not getting enough. You take your current weight and you divide it by 2. Now, there is actually a formula medically we use, and honestly, I feel like I give it to people. They're going to go, oh, Myrna, you're getting too sciencey. It's too hard. I try to make it super simple and still get you to the end value. So you take your current weight, not what you want to weigh, but your current weight, you divide it by 2, and that's going to give you the minimum protein grams that I would like to see from my patients, the minimum. Like I tell them, look, try not to go below that. Because I want to just give them fences and rules and just like, okay, don't do this and do that. Don't try to get at least that amount of protein a day. So if you weigh 200 pounds, you divide it by 2, it's 100 grams of protein. Now for carbs and fat, for carbs, I would take your ideal body weight and I'd multiply it by 1.3. That's going to give you approximately 45%. Now, a lot of people say, well, I don't need carbs. Carbs make me fat. Well, guess what? If you have insulin resistance, I totally get it. Carbs don't handle well in your body. But news alert, carbs are an important macronutrient. That's why you have only 4 of them, and you got to figure out how they work. So I'm not going to talk about the importance of carbs in this video. I'm just going to give you your values. And fats, you divide by 3, and that's going to give you 25% of the fat. And anywhere from 25 to 35% is pretty typical and average. So if you take your ideal body weight and you divide it by 3, so if you weigh 200 pounds, but your ideal body weight's 120, and you divide it by 3, you're going to come up with 40. That's 40 grams. That's 25%. So you could easily add another 20 grams on that. So 40 to 60 grams a day of fat is going to be relatively what you need in fats. Now, a low-fat diet probably is referring anywhere from 20 to 25. But they don't really measure it, so it's really hard for people to know. I am going to tell you because I am treating patients. I see their laboratory values. That's kind of what I do. And when I can keep their fats at the 35% and less, of course, unless they have the APOE gene, and I have a video on that, and that gene means that they have the Alzheimer's gene, so they don't clear fats as well as they should from the brain. And excess fats, not so good because it's a culprit of type 3 diabetes, right? Type 2 diabetes, type 3 diabetes, those receptor sites do get gunked up because we're not managing our macros. The amount of fiber you need from the CDC, they'd like to see you at least 25 grams a day, and I tell most of my patients, really, truly, 35 grams probably gets you more to the mark for a healthy microbiome. And on a plant-based diet, trust me when I tell you, you could be easily up around 60 or 70 grams. So they are so covering it on the fiber. And I'm not sure they're really giving us a good mark on the fats, but I wanted to give you that. So bottom line, let's get right back to the protein because I really want to bring that into play. Because with vegans, I never see a problem with their protein. They're usually fine with their carbs. The 2 macros that I see have a lot of problems is they're not eating enough protein and they're totally clueless on the fats. They're just thinking they can eat all they want and they're fine because they're no animal. But like I said, in this convention, they talked about plant-based and they really harped on lower fats. So I'm going to give you an example. In this slide, I show a 150-pound person, and I'm just going to divide it by 2. That's 75 grams. That's the Myrna method way of saying, oh my gosh, let's keep it simple. But the real formula that is typically used when they first started doing, and people with kidney disease would use this formula because it's really important they don't get too much proteins because they have kidney disease. But you take your body weight, you divide it by 2.2. That gives you kilograms. And then you multiply it by 0.8. That's a standard that I see often, and that to me would be the very minimum, because anything less than that, and how did they get to this? Well, they actually do what's called a nitrogen balance test, and they measure the amount of protein you eat to the amount you excrete, and they can measure the balance of the amount that your body absorbed through consumption to the amount you actually excreted, and then they came up with these formulas. But then I read studies later that they said, in doing these formulas that were done back in the 60s, they really didn't take into account that there's other factors like nitrogen that can be some of the losses through sweat. And I looked through the studies and I felt like, there is some doubt in my mind that possibly protein could be a little more. So by not getting enough protein, to me, would be more harmful to my patient than maybe getting just a little more than they need. So if you get a little more than you need, it's not a big deal. The body just breaks down those amino acids, breaks down the nitrogen, gets rid of it. Not a lot of stress on the body. Now, if you eat excessive amounts and it's from an animal, could be a big deal. So when I'm looking at advising protein grams, I sure as heck don't want them to be under. And why is that? Because when you don't eat enough protein, your body begins to metabolize muscle tissue. Not a good thing. Because when you start eating away at your muscle tissue, you also affect your immunity. I did a great podcast on how muscle really is tied into immunity. You affect your health when you start to reducing muscle. And the last thing you want to do is eat it. Why would you eat healthy muscle tissue? By the way, the only way you're getting it back is you got to exercise, and then the second thing you got to do is eat protein. Let me say that one more time. You got to exercise and you got to eat protein. That's how you build muscle. So just eating protein, sadly, isn't going to eat muscle. But not eating enough protein means you might eat away at the muscle you already have. So the last thing I want to do with any patients is if they're on a weight loss program, I am just like a hawk measuring their muscle mass. I have a little machine, an in-body machine. I want to try to make sure that we're losing mostly fat and we're not losing muscle. A lot of times people go on Ozempic, they lose a lot of weight. Sometimes you can lose a lot of weight too fast. You can lose a lot of muscle. So let's go back to the formulas. So when I look at this, taking your current body weight and dividing it by 2, what that formula actually looks like, because I don't want to give the formula. It's so, people are like, oh my God, it's too overwhelming, Myrna, stop. That's why I don't do it, actually. But the actual formula is taking your body weight, dividing it by 2.2, you're putting it in kilograms, and then you're multiplying it by 1.1. That's what it is when you take your body weight and you divide it by 2. So I'm already a couple points above this skimpy body weight divided by 2.2 times 0.8. And I'm saying minimum, I know I want you a few grams above that. And just to give you an example, if you take your body weight and you divide it by 2, it's 75 grams. And if you go over here and you take your 150 pounds body weight and you divide it by 2.2 and you multiply it by 0.8, it's only 54 grams. So on my formula, I've got you at 75 grams. And over here, you're at 54 grams. Now, once again, why do I want to play Russian roulette with your muscle? Heck no, heck no. So, and that's only going to be about another 10 to 15 grams, which if I had to give it to you in food value, that's probably 2 ounces of fish, 2 ounces of animal. It might be a cup and a half of beans. we're going to next talk about the bioavailability of the two different types of protein. And then added value from some of the studies that I've read. Healing and aging can increase your demand for protein. If you're bodybuilding more than 2 hours a day, some intense exercise could increase your demand because you're breaking down more muscle tissue. The body needs more to build up. If you're healing, same thing. If you're aging, I hate to say it's a catabolic event, you're breaking things down. So more reason for more protein. And then the other thing I want to talk about is the bioavailability adjustment with vegans. This is why with my vegans, I really want to harp on, love the fact you're doing the plant-based, good for you, your gut's tolerating, love it, but make sure that you're doing the macros. Get the fat right, and for God's sakes, please get the protein right. So in my program, if you're a vegan, you would easily, strictly vegan, you're not doing any animal, then you're probably going to be up around 90 grams of protein because I'm going to add an additional grams for the bioavailability adjustment. So as a rule of thumb, that's going to put you anywhere from 18 to 25% of your daily needs in protein grams. It's almost double over here, and I realize that. But once again, like I said, for my patients, I want to make sure we're not skimping. I want you to build all the muscle you can. And to me, it's not a big risk factor to up it by 25 grams. So let's talk about protein bioavailability. And I really, really want to stress that plant protein amino acids are the exact same amino acids in animal proteins. So let's just cut the discussion there because I'm really tired of people telling me animal proteins are far superior to plant proteins. First of all, they don't know the science of amino acids. Amino acids are amino acids. They're the same amino acids in plants as they are in animal. The difference is going to be the availability. That's what I want to talk about. Plant protein amino acids, by the way, amino acids are the building blocks of protein. So when you eat a protein, beans, tofu, in this case plant-based, or maybe chicken or fish, when you eat these proteins, they're made up of amino acids. They're just the building blocks of proteins. Not that it's a big medical term. It just means the building blocks. So there's like 22 amino acids, and your body can make a lot of them, and some are essential and some are non-essential. We don't need to get into that. That's too complicated. But what I want you to understand is these building blocks, these amino acids, they're the same in the plants as they are the animal. It's just in the plants. These amino acids share space with a lot of these healthy compounds, these isoflavones, a lot of these phytochemicals that are in the plants. And remember soy, we talked about those phytoestrogens, right? So these plant-based proteins share the space with some of these other compounds. So that means that it's not as bioavailable. So when you go to get the pure protein out of the plant, because your body is extrapolating some of these other healthy compounds to go off and do the wonderful things they do, but getting to the amino acids, it's also shared with other chemicals, so it's not as bioavailable. Except for soy protein, which is very bioavailable. In fact, soy protein has all the essential amino acids. With plants, some have a little bit of this, some have a little bit of that. But if you're eating a plant-based diet and you're combining grains and beans and vegetables, and you're eating from all the groups, which is vegans do, you're probably going to get a total composite of all the aminos you need. But will you get enough protein? That would be the question. So basically, when you're looking at this plant protein assessment, there is a Food and Agricultural Organization. They recommend, and there's certain scores used or tables they use. This is one of them. It's called the Digestible Indispensable Amino Acid Score. And they use this to try to give an accurate amount of availability. When you eat beans, how much protein are you able to actually extrapolate from the beans? So I wanted to go through that because remember, with plant-based, a lot of them are not going to be as bioavailable. With an animal, it's going to be more bioavailable. But remember, the quality of protein is exactly the same. The amount of amino acids, specifically in plants and animals, can change. But an amino acid in a plant is like the same amino acid in an animal. Just harder to get to in plants. Now an egg, which is like they consider the top of the list, 99% bioavailable, but your isolated proteins, your isolated whey, your isolated soy, your isolated pea protein, I should have added pea in there. I forgot to do that. Those are 95 to 100% bioavailable. That's kind of interesting, right? So that means it's isolated. They've actually isolated the proteins out. They're not letting you share it with a lot of these other chemicals. They've pulled it out. So isolated whey, soy, pea protein, that's going to be in a lot of these protein shakes, protein powders. And then animal protein and also soy, I have to include that in there. It's going to be anywhere from 95 to 100%, right? So you're going to get right to it. But the lentils and peas, they're more like 75 to 80% bioavailable. As we go down the list, beans are anywhere from 60 to 70 because different beans, different variations. Your grains are only 40 to 55%, and your nuts are only 40 to 50. So when you look at a grain and it says it's 8 grams of protein, it's probably going to be more like 6 grams you're actually getting a hold of. So what does this mean? It just means you've got to eat more if you're a vegan. That's all, folks. It just means, I'm going to go back to my equation, that if you're a vegan, to adjust for the bioavailability, you're just going to eat a little more plant-based foods. So that's why in my recommendations, and I tell everybody, take your ideal body weight, divide it by 2. And if you're a vegan, if you add even 10 to 15 grams more on that, you're going to be fine. Because remember, I've padded it some, you're padding it some more. But bottom line, vegans, I think, aren't aware of this. They're not aware that the protein matters when you're a vegan. It's just not as bioavailable, still the same quality. Just means they need to eat a little more. And I always talk about there's a difference between eating healthy and eating balanced. And healthy means that we're eating foods that have all these really healthy compounds. Eating balanced means we understand the macronutrients, protein, carbs, fiber, fat, in themselves need to be properly balanced, getting the right amounts. And with protein and fat, those are the two for my vegans. I'm really making sure, as they're eating all this wonderfully plant-based foods, don't skimp on the macros. So my summary with all of this is I do agree that we need to eat less fat, but I'm about eating the right amount of fat, right? So I'm not saying, oh, everybody go low fat, unless they have heart disease, type 2 diabetes, a certain genetic profile. I might drop their fats a little lower than 25 to 35. But at least having people know where their fats are. A lot of people say, I'm eating 35% fat, and they think they're on a low-fat diet. I'm like, no, that's actually how much you're supposed to have. And they didn't really talk about the amounts in the convention. So I was really unsure when they said low fat, what exactly that meant, like what value are you referring to? But I would agree. Eating less fat is going to be healthier. Plants have healing properties. I totally take that home because I've actually researched a lot of these plant properties and all the wonderful things they do. Fiber is amazing. It's what creates our healthy gut microbiome. And certain animal foods can be harmful to the gut. Animal foods create inflammatory, they can be a culprit for certain disease conditions. But it's all in balance, and I say that because if you're following the macros, what I have found with my patients, you pretty much, by the time you get the carbs and the fiber and you reduce the fat and you're looking at where your macros need to be, you really are eating a lot of plants and healthy foods, right? And you're watching the macros. And for most of my patients, even if they're eating animal, they're pretty much on a 70% eating plants, because what they find is they don't need that much protein from animal to make that protein hit, right? Also, maintaining an ideal body fat, super important. Know your macro values. This is where I really harp on it. Know your values and balance your meals. Regulate the protein and fiber, regulate the blood sugar using your protein and fiber. I also have studies. Another keynote, insulin resistance. That's a big thing I always talk about. Regulate your blood sugar. So for me, with the fats, it's about consuming your fat grams where they should be, and then regulate your blood sugar with protein and fiber. So when you eat carbs, you make sure that you balance them with enough protein and fiber. And that's really when I talk about helping people eat a balanced diet. Really, I'm referring to the science behind type 2 diabetes and insulin resistance, most of the metabolic diseases. So I did want to show you this too. I went there. Okay, so I think I covered everything. I know it's running late. It's been a really long stream. I really apologize about that. There's other studies. I've talked about it in my other podcasts. Just showing again how excess accumulation of lipid impairs insulin sensitivity and skeletal muscle. Once again, showing the science behind how an oversupply of fat to the tissue can actually contribute to type 2 diabetes, cardiovascular disease, and also ceramides, which they really didn't talk about, but I talk about all the time. I also have a book, super cheap. You can buy it on Amazon, on Kindle for $2.99. It's almost like you can't afford not to do it. But I do talk about why diets fail, and it's really heavily weighted on the macros, explaining to you the importance of why we want to balance it at meals and why we want our daily values and macros at a certain amount. You can also get me on my website at Myrna Method. I have a membership program where I help people learn how to balance, a web-based app teaching them how to balance their meals and the importance of the macros. So, Sam, how are we doing on the chat?
Good.
All right. Awesome. Thank you, and thank you. Don't forget to follow, subscribe, all those cool things. I love your support. And just thank you for being here and patronizing. It means a lot to me because it makes me work harder to help you. So the more interest, the harder I work, the more excited I get about helping you. Okay?
All right.
Good to go.